We go on to our next speaker, Dr. DEBRAJ, who is a very leading facial plastic, oculoplastic surgeon of the world based in Mumbai. And his video would be played, but I do wish he's connected. Very unfortunate that he's been unwell. I do wish he's able to answer any question which comes along. So shall we run the video, Dr. Anand?
Yes, good day, everyone. Thank you for having me here. My name is DEBRAJ, and I shall be speaking on my most difficult case in this particular presentation. Certain financial disclosures are a must. I am a faculty and a trainer for Allergan, MERS, and Aptos for the past decade. And obviously, the aesthetic clinics, which is now in multiple cities all over India, we would never be as good as we are with some of our results if it wasn't for our dermatology team, which does a wonderful job in making our surgical results look better. Please do not record this presentation, and please do not disseminate this presentation or the patient photographs in any way without our written approvals. In general, facial plastic surgery is a fast expanding super specialty of plastic surgery. And we understand that facial plastic surgery or aesthetic surgery can be divided into reconstructive, cosmetic facial plastic surgery, and the non-surgical rejuvenation procedures. Now, today's case is going to be talking about reconstructive facial plastic surgery, and mainly due to trauma.
We are not getting the,
Nasal tip refinement is amongst the most complex tasks, especially in a broken and traumatized nose. A broken and traumatized nose is pathological from the sense that it has a lot of scar tissue, and that is why nasal tip refinement, rhinoplasty, becomes even tougher. This video attempts to demonstrate the surgical technique as well as the thought process behind nasal tip refinement techniques used in a broken and a traumatized nose. Our patient is a 32-year-old Iraqi lady who was a bomb blast victim. The bomb blast led to the loss of her right eye and led to a huge nasal abnormality, leading to deviation of the nasal septum as well as a huge bulbous nasal tip due to the formation of a large amount of scar tissue post the injury. This video is not only about surgical skills, but it is also about human suffering. How do we, as plastic surgeons, get such a young lady to lead an essentially normal life is the real story behind this video. This is a close-up of the patient's face showing the nasal as well as the facial abnormalities which have developed post the injury 1 year ago. The patient needed a right eye reconstruction with prosthesis fitting into the socket which remained. Since the facial bones had fractured post the blast injury and these had not been united properly by craniomaxillofacial surgery, this needed a face transplant-like surgery where we had to break all the malunited facial bones and reunite them. This was akin to breaking all the facial bones which had malunited and refitting them almost like a jigsaw puzzle. This was an interesting surgery, which was subsequently covered by Reuters as well as top newspapers globally. The focus of this particular video, though, is the rhinoplasty surgery, especially the tip refinement, which was carried out in this particular patient. The plan for the nasal surgery in this patient was to lower the nasal dorsal hump, recenter the nose and straighten the nasal septum, create a vertical dome division, which is a hockey stick reduction of the lower nasal cartilage, and to straighten the columella and to make the nasal tip triangular from a bulbous tip. The lady had thick sebaceous skin. In addition to this, she had developed a large amount of scar tissue which also needed to be reduced over the nasal tip to give it a more refined triangular looking nose. The hockey stick method involves vertical dome division and modest excision of the lateral and the medial crural elements to refine the nasal tip, thereby shifting the nasal tip from a boxy one to a triangular pyramidal one as is shown in this photograph. The key word is modest excision. which means a severe excision will lead to long-term changes in the nose and failure of support elements of the tip in the longer term. This is a photograph which demonstrates the changes which can be brought about by the hockey stick technique of vertical dome division. While the hockey stick technique has been reported earlier for tip refinement, to the best of our knowledge, it has never been reported before in a traumatized nose. A transcolumellar broken line incision was used to gain access to the nasal tip. The scar tissue on top of the nasal cartilage and underneath the skin envelope was slowly trimmed down. Vertical dome division was performed. The callus on top of the nasal dorsum was slowly
Why has the volume gone?
Those are the osteotomies being performed, and the osteotomies are performed to medialize the nasal bone and to make the nasal bone come closer, thereby giving rise to a much more refined nasal appearance. These are the transdermal sutures being taken, and the medial cruce of the lower lateral cartilages are being sutured together using, in this case, 6-O-proline sutures. That's the nasal tip complex which has now been created, and you can see how the nose already looks a lot more
The transcolumellar incision is now sutured with 6-O proline sutures. The nasal tip is now taped with steri strips to support it, and then a thermoplast plaster is put in place to support the entire nose. This is the final picture of the patient taken 6 weeks post-operatively. This is how the patient had presented to us, and this is how the patient now looks 6 weeks post-surgery. Quite a remarkable difference, isn't it? This case, both from the human interest angle as well as the surgical achievement, was reported in a number of top-line newspapers globally as well as by Reuters. In summary, meticulous nasal tip refinement techniques performed in broken and traumatized noses can give wonderful post-operative results. Hockey stick technique
So in essence, we have demonstrated a craniomaxillofacial surgery. You have seen only one part of the surgery, which is the nasal refinement. But in general, this patient underwent a transcoronal flap, and we've gone ahead and taken the entire face down and repaired all the bony fractures of the face, literally in a jigsaw puzzle-like manner. This was an 11-hour surgery. And after multiple surgeries and post the prosthesis fitting, this is how you can you can see the patient, how the patient looks immediately post the surgery, approximately 6 weeks later. So these are the sort of changes which can be brought about. And in that sense, every fracture, every surgery on the face is actually an aesthetic surgery, because we get a chance to really impact the patient's life completely. That's the patient with a much younger looking me about a decade ago. And the patient has been on follow-up since then and is doing really, really well, even now with the prosthesis and all the fractures which have done. And the scars have healed beautifully well. Obviously, the scar is behind the hairline, so nothing much can be seen on the face in that sense. Now, this brings us to an important point. Whenever we have training fellows, we are actually training them in orbital surgeries, especially in oculofacial plastic surgery in India. However, we wanted to also discuss what are the sort of fractures which are typically seen at a tertiary care trauma center. So the WHO statistics are that Indians are driving faster than ever before, and the Ministry of Road and Traffic in India tends to suggest that there are about 15 million Indians who die on a yearly basis just from road traffic accidents. The face is obviously the most exposed part, and it's commonly injured during the road traffic accident. And that's why maxillofacial trauma becomes very important, to do it properly and to give the patients a better life. Now, some fractures will remain restricted to the orbit, but in general, craniomaxillofacial injuries will involve the other orbital wall as well as the rest of the face as well. Therefore, we need to train our surgeons, whichever discipline they come from, in treating fractures of the entire face holistically. Now, this was a retrospective study, and this was conducted on the number of facial plastic surgery performed in facial fractures, which had come to the aesthetic clinics from 2006 to 2019. And that's some of the data, with a 2-year follow-up being followed. And after the patient has been stabilized, obviously the airway, the circulation, and making sure that the person is breathing properly are the most important. After that, the CT scans are examined, and then we perform a complete evaluation. Generally, many of our traumas, which involve the frontal bone as well, are operated with the neurosurgical intervention as well. And these are some of the treatments which had to be done. Now, if we look at the 1,508 patients who were included, we can see that there is a positive correlation of the age with the degree and the nature of trauma. We can see that males, as has been seen in other parts of the world, are significantly more prone to road traffic accidents. And the commonest cause of facial injury was actually road traffic accidents, followed by assaults and sports injuries. And that's the entire breakup over the 13-year period of this retrospective trial. These are the types of fractures. And you can see that while obviously the aesthetic clinics were started by the oculofacial plastic surgery genre, but now we have multiple surgeons, and you can see that the orbital fractures, even though they formed a majority of the number of fractures which we were seeing, which can be, it can be a confounding variable given from where our practice started, but you can see that the panfacial fractures and the complex facial fractures account for significant number of trauma. So as much as 68% of the number of patients who presented with trauma did not have only isolated orbital fractures. And these were the treatments which were done, with open reduction and internal fixation being the typical way of treating the fractures, but there were other procedures required as well. And these are, of course, some of our patients with a frontal fracture, with maxillofacial trauma, zygomaticomaxillary fractures, comminution of the maxilla itself. And these are how the patients look after multiple procedures have been performed. In general, the fractures are common in the young males, peak incidence being between the 2nd and the 3rd decades of life. And most importantly, only 30% of the trauma or of the fractures in our trial were isolated to the orbit. A multidisciplinary approach becomes better, and we need to make sure that the future surgeons who are being trained in whichever discipline or whichever residency they come from are being trained to treat facial fractures holistically all over the face. This study has also been accepted in the Craniomaxillofacial Trauma and Reconstruction, or the CMTR journal. And this is, of course, how carbon dioxide laser resurfacing also is performed. And ancillary skin treatments like these can make our fractures look much better post-treatment. These are some of the trials which have come out of the aesthetic clinics over the past 3 to 5 years. And you can see varied topics, including facial fractures, etc., as a result of which we believe that any cut on the face is actually an aesthetic surgery. It doesn't matter whether it's a fracture or a tumor as well. These are some of our training programs we love to teach. And if you would love to learn, please contact us when we are happy to train you. And that's a book which has now a bestseller on Amazon. It has been written by 30 of the topmost doctors and surgeons from across the globe. And it talks about, the great things that we as doctors do. And it's something that we recommend reading by all of you to feel more energetic and to also feel proud of what our fraternity as doctors is achieving, especially at these COVID times. Thank you for your kind attention and a patient hearing. And that's my email address. And if there's anything that we can address, please don't hesitate to reach out. Thank you very much.
Thank you, Dr. DEBRAJ. That was a wonderful talk. It is just that when you're dealing with some very high profile patients, I'm sure there are certain predictable parts and unpredictable parts. It must be a challenge for you to counsel these patients, and the results may be not exactly idyllic in all times, no? Are you there?
Yes, ma'am, I'm there. Good evening, everyone.
Yeah.
Yes, ma'am. Obviously, one question that we get asked all the time is a fracture case which has multiple fractures on the face. Is that more challenging as a surgeon, or is performing a 1 millimeter lift of the tip of the nose using fillers more challenging? I think the challenges are different in both these particular conditions. In one, which is the surgically challenging cases, the people are willing to accept even slightly subnormal results, whereas the people who are coming in who are actually normal looking patients and want to look super normal, their expectations can be very high. So therefore, patient management, good communication, and great consents are very, very necessary in order to make sure that we take care of our patients really well. And in that, managing the mental state of the patient is also as important as managing the physical state, ma'am.
Thank you very much, DEBRAJ. Thanks a lot for those words. I know it must have been difficult for you to stay connected.